Death is a part of each person's life. We all face it, and unfortunately, many people find themselves at the end of their lives sooner than they would prefer. Terminal illness, in particular, puts dying people in a position where they're often aware of their situation for some time, weeks, months, or even years. And in these circumstances, especially when in pain or very low quality of life due to their illness, I think that euthanasia should be an option so that one's end-of-life experience can consist of less suffering for patients and their loved ones. In addition to the ability to provide a more comfortable end of life for patients, death is a human right that we should be able to choose, and contrary to popular belief, euthanasia should be an important part of the Hippocratic Oath, not a violation. And for these reasons, the U.S. government should federally legalize euthanasia. So, euthanasia is basically the painless killing of a patient suffering from an incurable and painful disease or in an irreversible coma. And in most countries, this is illegal, but it allows for less pain associated with terminal illnesses such as cancer, or other common ones include AIDS, Alzheimer's, dementia, diseases that will deteriorate the mind to a state of confusion. And according to Professor Roger Crisp of the University of Oxford, in his article, Assisted Dying and Protecting the Vulnerable, the most significant vulnerability in many of the terminally ill is the agonizing, chronic, and unrelievable pain. He says that at a minimum, patients should at least have the chance to initiate their death to avoid further suffering in low-quality life during their final period. Euthanasia allows for relief to families, loved ones that have been accompanying an ill patient through the pain of dying. In a study of euthanasia cases in Europe, pain was the reason for euthanasia in about half of cases. Loss of dignity is mentioned as a reason for 61% of cases in the Netherlands and 52% in Belgium. And euthanasia allows loved ones to plan for afterlife arrangements and allows for the ill to prepare for their death, making arrangements to see friends and families to make sure they have a completed will and make any last wishes. And in addition to an improved end-of-life experience, death is a basic human right. There's no harm done to others by ending one's suffering, and euthanasia should be a choice for anyone in a state of constant pain due to terminal illness. For those that are opposed to the legalization of euthanasia, they're often concerned with the devaluing of life. If euthanasia allows us to end our lives in sickness, why wouldn't people think of life as less important? Richard Dorflinger says that campaigning to end certain people's lives doesn't end suffering. It passes on the suffering to other similar people who now have the fear that they are the next people in line to be seen as having worthless lives. And people who have died from a drug overdose have no freedom of choice at all. Moreover, societies that authorize suicide as choice for some people soon end up placing pressure on them to do the right thing and kill themselves. Seeing suicide as a solution for some illnesses can only undermine the willingness of doctors and society to learn how to show real compassion and address patients' pain and other problems. So, what are the guidelines that constitute euthanasia? What degree of sickness is necessary to decide that it's okay for a health professional to assist in the dying process? Well, in the United States, there's 7 states total that have a form of euthanasia legalized. And here, in particular, they vary, but Oregon has the following standards for euthanasia in patients. So you have to be a resident of Oregon. You have to be at least 18 years old, and the patient has to make 2 oral and 1 written requests for euthanasia. There has to be at least 15 days between the first and last request, and the patient must be terminally ill with a life expectancy of less than 6 months. This prognosis must be confirmed by a second consultant physician, so there has to be another doctor that can confirm that the patient qualifies for euthanasia, and both doctors have to confirm that the patient is capable of making this decision. Both doctors must confirm that the patient does not have a medical condition that impairs their judgment. And the patient must self-administer the lethal medication in Oregon, which is kind of unique. So instead of the doctor actually injecting a chemical that will end their life, they have to do it themselves. So it's a self-administered euthanasia in this case. And so while many can see the benefit and necessity of the choice of euthanasia, a roadblock for many health professionals is that there's this heavily debated responsibility to do no harm, which is part of the Hippocratic Oath, an oath that all doctors anyway take when they begin their medical career. And it's difficult to justify euthanasia or assisted suicide based on this ideal. However, when in a state of anguish and close to death, euthanasia is not necessarily harmful. In these end-of-life situations, euthanasia allows for more comfortability and less harm to the mind and emotions associated with the process of dying. So I think that euthanasia should be an important component of the Hippocratic Oath, not a violation. Euthanasia allows loved ones and the patients themselves near the end of their life to avoid the emotional and physical pain associated with those final days or final weeks. There's a study done on euthanasia where the bereaved family and friends of cancer patients who died by euthanasia actually had less traumatic symptoms of grief. They also had less current feelings of grief and less post-traumatic stress reactions than the family and friends of patients who died of natural causes. These differences were independent of other risk factors. So basically, having a planned death, which to you and I, that probably sounds very intimidating, and it is. It's very scary, but it allows the family and the patient themselves to prepare and take care of anything that needs to be before this person's life comes to an end. And in her article, Euthanasia, Easier on Loved Ones, Serena Gordon from Health Day reports that the researchers suspect there are several reasons friends and family of people who died by euthanasia had fewer symptoms of grief. One is that they had time to prepare and talk about the death. Another is that they had a chance to say goodbye to their loved one. According to the study, this planned end of life allows for families to prepare themselves for the loss and helps reduce the grief of watching their loved one experience a painful death. In circumstances of terminal illness, especially when in pain or very low quality of life or inactivity in the brain, euthanasia should be an option so that one's end-of-life experience can consist of less suffering for patients and their loved ones. Death is a human right that we should be able to choose, and contrary to popular belief, euthanasia should be an important component of the Hippocratic Oath, not a violation. For these reasons, the U.S. government should federally legalize euthanasia and allow people suffering from terminal illnesses to increase the comfortability of the end of their life experience. Patients, especially in a state of uncertainty such as dying, deserve to have options and the support of medical professionals. In some cases, the terminally ill often decide to take their own lives, and this sort of scenario, while perhaps appropriate from the patient's perspective, it's not comforting to family members or the patients themselves. And terminally ill patients deserve to have this choice and the medical expertise to assist them in an end-of-life procedure.